What causes under eye puffiness and darkness? Is filler always the answer? Hi, and welcome back to Face It with Dr. G. I'm Dr. Freeling, and welcome to the channel. Please hit subscribe, like, and share this video, and I can't wait to have you. The under eye skin is the thinnest and most delicate of our bodies. It measures about 0.3 to 0.5 millimeters in thickness. And because of this and the sensitivity of the skin, it's one of the first places of our face, of our facial skin, to show the signs of aging. The lower eyelid is a common concern, and patients typically present to my office and say, I feel like I look tired, or why are my under eyes so swollen, or why do I feel like I look sunken and dark? The under eye is very complex, and it's really important, and I stress that you see a provider that knows advanced anatomy and physiology of this area, as well as advanced injection techniques for rejuvenation. It's paramount that you understand what the cause of your specific under eye condition is. So under eye puffiness is very different from under eye darkness. Darkness and a tear trough deformity that form are from volume loss. Darkness can also be due to sleeping habits, we'll get into that. And puffiness has a very different etiology. So let's discuss the different causes and then how we address them. So let's first talk about causes of under eye puffiness. So the first thing that comes to mind is lack of sleep. And I know it's a crazy day and age. We don't sleep very much. We have so much to do every single day and every single night. When we don't sleep, the blood vessels around our eyes actually get bigger or dilate. The size of them gets bigger. That causes increased blood flow to the under eye area. And because the skin is so thin, like I mentioned, that redness from the blood actually causes darkness. You can also have darkness from other reasons, but sleep is a big one. Because of that increased blood flow under the eye, this is added volume and can lead to puffiness and discomfort. The next thing is your diet. So we all know that we go out and we have a really fun night, we eat a lot of salty food, maybe we have a couple alcoholic beverages, and we wake up with really puffy eyes. And there's a couple reasons for this. Number one being that high salt intake increases overall total body volume. And because our eyes are so sensitive, it really affects our under eyes. The other thing is when we sleep, we don't blink. And blinking actually facilitates that movement of fluid around the eyes. So while our eyes are closed, that puffiness can really build up and the fluid builds up. So when we wake up, we have puffy eyes. The next thing is allergies. So we may suffer from seasonal allergies or year-long allergies. I myself have them year-round. And allergies cause congestion and puffiness around the eyes, as well as irritation. And the first thing I do a lot of first things when my patients come in, don't I? But one of the main things I do if a patient comes in and is concerned about the eye area is observe them, analyze them, and make a determination, and then ask them, do they have allergies? And many times patients are surprised. How'd you know? How'd you know I have allergies? Well, it's often pretty obvious. And the thing about it is you want to know the reason for the swelling before you go in and treat. Because if they have allergies and there's fluid there that can be removed with an antihistamine that's taken daily, there you go. You've solved either the whole problem or part of the problem. The reason for understanding the etiology and the importance of this is because the minute we introduce another substance into this sensitive under eye area, you're potentially decreasing that flow of fluid even more so. You're potentially decreasing the lymphatic drainage. So we really want to understand what the problem is, how we can prevent it without doing any injectable treatments, and then the proper way to treat if we do injectable treatments. Another good remedy is a topical eye cream that can help with smoothing fine lines and wrinkles of the under eyes, but I would like to stress that under eye creams do not help or improve under eye puffiness. A lot of people think that putting creams on under your eyes help with that puffiness, and it's not true. So just wanted to clarify that for you guys. Another really important distinction is understanding the difference between swelling and fluid and fat that's around the orbit. And we have our eyeballs encased with fat. And as we age, the ligaments and muscles, specifically ligaments, loosen around our eyes. And this allows some of that fat that insulates our orbit, our eye, to prolapse. And we can get that in the lower lid mostly. We can also get that above the eye, but a lot of patients come in with this bulge under the eye, and if that's fat, you obviously want to distinguish that from fluid. If your diagnosis is that this is prolapsed fat around the orbit, the treatment for that is surgical, and it's a very easy, straightforward surgical procedure, but it's a blepharoplasty. It can be an upper and a lower eyelid blepharoplasty where that fat is actually removed. There are instances where I will educate patients that a little bit of filler can help mask the transition between the bulge of the fat and the mid-cheek. However, you want to be very, very careful and make sure you go to a specialist for the best recommendations. Another reason patients can have under eye swelling is from prior injections, and patients often don't even have to volunteer that they've had injections, and maybe these injections specifically under the eye were years ago. We like to hold on to filler that we don't like, specifically under the eyes. So patients that have had filler placed, maybe they had prior swelling and that filler has impacted the lymphatics, that filler has absorbed water, and it can cause swelling, and it can be chronic. You can get swelling of the fat pads around the eye. And these things can be very bothersome for patients. So it's extremely important that you see somebody that can correctly assess you and diagnose your specific situation. Another thing to look at is your family members. So if you see that your mom or your dad or your grandparents have a specific look around their eyes, maybe you're genetically predispositioned to have one of these conditions. Be it allergies, be it prolapse fat around the orbit. It can help you make a plan for yourself, seek out some advice and do some research, but your genetics do play a role around the eye, how you age, and different symptoms. And last but not least, lymphatic outflow insufficiencies are really one of the key players in under eye swelling and puffiness. The lymphatic flow and system around the eyes, to begin with, without any alterations, is weak and inefficient. So any adjustments, any additions of volume are going to cause that system to be weaker, impact the amount of fluid, and cause puffiness. Medical conditions can also affect the eye area, the periorbital area. Things such as thyroid disease and kidney disease, they affect the eye differently. Specifically, thyroid disease can affect the concentration of the fat that insulates the orbit, and you get more fat there, which can cause prolapse or bulging of the eye. So proptosis is when the eye sticks out just a little bit, and that is one of the symptoms or signs, clinical signs of hyperthyroidism. Nephrotic syndrome is one of a certain type of kidney disease and other chronic kidney diseases that can cause puffiness, and the puffiness is actually fluid. So these two medical conditions can cause under eye clinical symptoms, different in etiology, fat versus fluid, but can affect the under eyes. In contrast to swelling and puffiness under the eyes, I'll mention just briefly volume depletion or loss of volume under the eyes. This can cause darkness and a tear trough deformity that you often see diagonally across the side of the face from the inner eye, diagonally. You can also see sometimes an indent around the orbit, the lateral orbital rim, where you've seen volume loss as well. And these are signs of aging. We get volume loss with aging, we get loss of collagen, loss of hyaluronic acid. We also can get darkness that contributes to this shadow from a tear trough deformity. Overall, can cause us to make us appear sunken and feel tired. Patients that have volume loss without any other swelling are great candidates for volume replenishment and replacement gently and gradually under the eyes. I hope this helped clarify many questions and concerns for you guys regarding the under eyes. Don't forget to like, subscribe, share this with your friends and family, and I'll see you soon.